Good afternoon, ladies and gentlemen, and welcome to Urban Review, the show brought to you by the Center for Urban Youth and Family Development and the Coalition for Urban Youth and Family Development. The thoughts and the words expressed on this show are not necessarily the opinions and thoughts of the Office of National Drug Control Policy or the White House, which is the sponsor or co-sponsors of this show. Thank you today. Welcome to another episode of Urban Review. We're in the month of May of the year of our Lord 2021. And this month has already been a very exciting month. Just this past Sunday, we had No Menthol Sunday. I have my No Menthol Sunday mask that I wore to church. And we talked about the fact that No Menthol Sunday, May 16th, was targeted to try and make African Americans aware of the harsh impact and negative impact that menthol flavored tobacco products have had on our community. Back in 1947 or 1957, I'm sorry, only about 18% of all African American smokers smoked menthol flavored cigarettes. Today, that number has increased to 82%. And the reason that is because Big Tobacco has targeted our community with all types of marketing strategies and marketing programs that frankly were very successful. They came to the black community and they gave away menthol cigarettes. They gave away t-shirts and sun visors and cigarette lighters and coupons and all type of marketing, merchandising aids and marketing strategies to bring this product to the black community. And so just recently, the FDA has announced that it will be taking efforts to eliminate the sale of menthol-flavored products and to ban those menthol-flavored cigarettes from being marketed. Now, there have been people who have said, oh, man, that's going to knock out our cigarettes. Well, the reason that they're our cigarettes is because they have been shoved down our throats through the marketing and strategies. And in fact, just a little information about tobacco. The CDC estimates that Michigan saves $1,623 a year in health costs for each smoker that quits. So smoking and quitting smoking is a very positive thing. And if you need help, all you've got to do is call 1-800-QUIT-NOW. That's 1-800-784-8669 or 1-855-335-3569, and that is for our Hispanic or Spanish-speaking citizens. Once again, that's 1-800-QUIT-NOW, which is 1-800-784-8669. 1-800-784-8669, or if you're Spanish-speaking, 1-855-335-3569, and you can get assistance in trying to help with the tobacco products and trying to quit smoking. And if you're Arabic, you can call 1-800-784-8669, and that will also give you some help with getting rid of that hookah. The hookah, a lot of people are switching from the menthol-flavored cigarettes to the flavored tobaccos that are being utilized in the hookah. They believe that the water bottle is going to reduce the amount of harmful substances in the tobacco smoke. Well, in fact, the water cools the hookah smoke, tobacco smoke, so that it feels less harsh, and therefore you inhale it more deeply and you hold it in more longer, so therefore it actually increases the harm that the tobacco can do to you. Also, the hookah believers believe that hookah users believe that the smell and taste and smoothness of the sweetened and flavored tobacco causes less irritation to the airways. But in fact, this leads to a sustained period of higher harmful exposure to the toxic substances that are found in hookah tobacco. So hookah smoking is just as bad as smoking cigarettes and just as harmful. So if you need help, call 1-800-784-8669. That's 1-800 quit now. Did you know that the month of May was Mental Health Awareness Month? And May 15th through May 22nd has been declared Suicide Prevention Training Week. Our Governor Gretchen Whitmer, made a proclamation, whereas May is known as Mental Health Awareness Month and is intended to help promote awareness surrounding the resources available to us and to our communities. And some mental illnesses and life stressors can come with suicidal thoughts and can affect anyone regardless of race, gender, age, orientation, income level, religion, and or background. And according to a report released in the 2020 American Foundation for Suicide Prevention in Michigan, on average, one person dies every 6 hours by way of suicide. That's correct. One person dies by suicide every 6 hours, and suicide happens to be the 10th leading cause of death on average, and the second cause of death for ages 10 through 34 in the state of Michigan. And in 2019, more than 74,500 people died by suicide, and 12 million American adults seriously thought about suicide. And Michigan has higher rates of suicide among people 10 through 19 and 25 through 44 years of age compared to our nation as a whole. And surviving families and friends not only suffer the trauma of losing a loved one and a loved one to suicide, but are at higher risk themselves for attempting suicide. And the Michigan Department of Health and Human Services, the Michigan Association of Suicide Prevention, the Michigan Suicide Prevention Commission, and the national and local suicide prevention organizations, which includes the Detroit Wayne Integrated Health Network and the Center and Coalition for Urban Youth and Family Development, have been working closely and tirelessly to halt the growth of suicide rates in Michigan. And Michigan's federally funded Transforming Youth Suicide Prevention Program is committed to lowering the youth and young adult suicide rate by creating true sustainable change through awareness and intervention in both state and local systems that serve youth and young adults. Michigan can reduce its suicide rate by employing best practices, gaining community involvement, encouraging Michiganders to seek help through open, direct, and honest talk about suicide. And Michigan Suicide Prevention Training Week is held both virtually and in person with full safety precautions starting the 15th through the 22nd, in which suicide prevention skilled trainers throughout the state have been offering and will continue to offer a number of classes to save lives across our great state of Michigan, especially with the mental hardships many individuals are facing during the COVID-19 pandemic. Therefore, Gretchen Whitmer, Governor of Michigan, hereby proclaimed that May 15th through the 22nd, 2021 is Suicide Prevention Training Week in Michigan, and promotes the awareness that there is hope and that suicide is preventable. So I wanted to just do a few things today to focus on suicide prevention. And one of the first questions we ask is, well, why is this important to the African American community? Well, in October of 2020, the U.S. Department of Health and Human Services did an African American youth suicide report for Congress. And I decided to just take a look at that. I Googled it, and it came right up. And it said that Congress requested the Department of Health and Human Services to submit a report examining reasons why black children ages 5 to 12 are dying by suicide at a nearly twice the rate of their white counterparts. To supplement the limited research that investigated reasons for higher suicide rates in black children compared to white children, they analyzed National Violent Death Reporting System data between 2014 and 2017 to examine the risk and predicating factors in 274 non-Hispanic black children and 1,992 non-Hispanic white children ages 10 to 17 who died by suicide. Compared to their white peers, black youth had higher rates of experiencing a crisis in the 2 weeks prior to their death by suicide and had a family relationship problem or arguments or conflicts and a history of suicide attempts. In contrast, black youth had lower rates of a current known mental health problem, current depressed mood, a history of suicidal thoughts or plans, and either a past or current treatment for mental illness compared to white youth. Lower rates of current or past mental health problems, despite higher rates of past suicide attempts, suggest that black youth have limited access to and utilization of mental health services. The early detection and mitigation of formidable, modifiable risk factors for suicide, including identification and treatment of mental illness, interpersonal problem-solving skills training, and family-based interventions that improve interactions are critical components of evidence-based suicide prevention interventions in black youth and children. Prevention of the downstream outcome of death by suicide in black children and youth cannot be achieved without actively addressing the upstream factors such as healthcare disparities and social determinants of health, including racism. And all of these factors have been highlighted during the COVID-19 pandemic, where we have discovered that there are disparities in healthcare, in the healthcare systems, in the healthcare being provided, in the opportunities for healthcare in the black community. And we're finding that it is having an impact on our youth and on our children as they are attempting and having suicidal ideology and actually completing suicides. The report that was submitted by the Department of Health and Human Services was incorporated by the African American Children and Suicide Committee that was concerned that the suicide rate among children 10 to 17 increased by 70% between 2006 and 2016. The committee was also concerned that African American children ages 5 to 12 were dying by suicide at nearly twice the rate of their white counterparts. Accordingly, the committee directed the Office of the Surgeon General to submit a report that on the pressing public health issue and wanted to understand the factors that were causing the disparities, as well as what type of evidence-based interventions were available. And the Surgeon General collaborated with the CDC, with the Substance Abuse Mental Health Services Administration, with the National Institute of Minority Health and Health Disparities, and the National Institutes of Mental Health, and the National Institute of Child Health and Human Development, as it was appropriate in order to gather all of the data that they needed. And when you started analyzing the data, some of the statistics really jumped off of the page. There was a misclassification of the cause of death in children and youth, introduced errors in the calculations of death by suicide, and that was discovered back in 2010 and also verified in 2018. And it noted that suicide often was misclassified as a homicide, and that might explain much of the African American white suicide gap. But a hypothesis supported by analysis of morbidity data showed that that was an unintentional death due to injury, and that between 1999 and 2018, despite the clear need for reliable morbidity data, there was no data available. But we found that the risk factors with higher suicide rates among black children as they compared to white children, that there were several factors that were involved. Compared to early adolescence, who died by suicide, children's ages 5 through 11 who died by suicide were more commonly male, black, more likely to have relationship problems with their family and friends, had higher rates of attention deficit hyperactivity disorder, and died by hanging, strangulation, suffocation at home. A lack of significant differences in precipitating circumstances, suicide-related circumstances including the history of suicidal attempts and mental health characteristics between 32 black children ages 5 to 11 compared to 55 non-black children were most likely due to small sample sizes and that the data was only taken from 17 different states. But the additional risk factors for black youth are social determinants for health, including lower socioeconomic status, lower educational achievement, unemployment, living in high poverty neighborhoods, and homelessness. They also examined the prevalence of depression and suicidal ideology in black youth experiencing homelessness and found a high prevalence rate of depressive symptoms and suicide ideology. They examined over 2,400 minority youth and found that youth who had experienced racial, economic, ethnic discrimination were at higher risk for depression and more likely to have suicidal thoughts. There are several important considerations when examining suicide among younger children 5 to 12, and the first is the misclassifying of the cause of death. A second are some medical examiners may be reluctant to name the cause of death in children, especially those younger than 10, as suicide. Third, misclassifications are likely change over time, introducing errors when combining cases over multiple years. But the bottom line is our children are committing suicide, and we have to put together some significant programs to address the disparities in health care, the availability of health, and specifically the availability and the utilization of mental health wellness opportunities. We'll be back right after this message from our sponsors, and we'll talk a little bit about what are some of the things that you can do in your day-to-day activities that can help prevent suicide. Thank you. We'll be right back.
Meet Danny, high school senior, 17 years of age, all A student. Danny is just now finding out he scored 1,490 out of 1,600 on his SAT. Danny's friend decided to ask, "How did you do it?" Danny replied, "I believe every day is a test. To fail or succeed, you choose." The effects of vaping is the one test that Danny chose not to study for.
Vaping does not discriminate on who becomes addicted. Over 2 million high school students use some type of electronic cigarette device. The top tobacco companies also own vaping devices. The FDA found that vaping contains some of the same toxic chemicals as regular cigarettes that lead to cancer. So whether you smoke traditional cigarettes with tobacco or smoke electronic cigarettes using nicotine, your health is at risk. There's no safe way to smoke. For more information, contact the Center for Urban Youth and Family Development.
You will love your Avis Ford because at Avis Ford, we make it easy to get you your no money down monthly payment right over the phone. We call it Shop by Phone, and it's the best way we know to get you your payment options fast. You want leather and a sunroof? How about an upgrade to all-wheel drive? Just give us a call. Shop online, shop by phone, or visit us at Telegraph at 12 Mile. Call 1-800-SHOP-FORD.
The Center for Urban Youth and Family Development is a nonprofit organization that focuses on preventing personal problems we believe are facilitated by being raised in a foster care environment, or remediating potential problems through education and information to the community. Our programs focus on 3 key areas: youth aging out of foster care, community action, and healthcare. Our programs are focused on young adults in the foster care system who are about to age out, those that have just aged out, and the community at large. The Center for Urban Youth and Family Development hosts a variety of services focusing on the needs of foster care youth throughout the community. We also work with numerous community coalitions in our effort to provide the best services for our clients and to help build stronger communities. We believe that a healthy mind and body are cornerstones to a healthy and prosperous community. The center also engages our community in mental health and wellness advocacy as well as suicide prevention. Fostered youth emerge from the foster care system vulnerable to substance abuse with little opportunity to obtain higher education or develop life skills. The Center for Urban Youth and Family Development empowers youth that are in and transitioning out of the foster care system to overcome the struggles and challenges by providing them substance abuse prevention, life skills training, and workforce development programs. Drawing from the life experiences of our founder, Mr. Marcel Arbuckle, we open the door to positive and productive life through education, health, and life skills development. For more information, you can visit our website at cuyfddetroit.org or check out our social media at cuyfddetroit.
The non-medical use of prescription drugs, including opioids, is a growing concern in our communities, affecting all ages, including our youth. If the medication wasn't prescribed to you or has expired, don't take it. If your name isn't on the bottle, it's not meant for you to swallow. Addiction is real, and lives are being ruined. Or worse yet, lost.
Visit preventiondetroit.org/opioids to find prescription Dropbox locations.
Back, and as I indicated before our break, I was going to provide you, and I'm going to provide you, with a brief strategy that you can use to work on to develop to help prevent suicide. And it's called QPR. Q stands for question, P stands for persuade, and R stands for refer. When you are interfacing with your friends, your relatives, with young people, with anyone, if you notice that they're down in the dumps, if they seem depressed, if they are evasive in their thoughts and their interactions, then question them. Ask them, is everything okay? Ask them, are they experiencing problems? Ask them, are they down? Ask them, are they depressed? And question how they feel. And if you believe that you determine that this individual has a state of depression, that they are having suicidal thoughts or ideology, then the next thing to do is to persuade that person to get some help. Question, then persuade. Persuade that individual to seek out some assistance. And then the last thing is to understand that you're not a psychiatrist, you're not a counselor, you're not a social worker, you don't have the answers. So the next thing to do is refer. If you're a young person, you need to refer the person to a responsible adult that can get them some help, even if you've had to promise them that you wouldn't tell anybody. If you want to save their life, you're going to tell. You're going to share with a responsible adult and refer that person to get some help. If you're an adult, then you need to refer that individual to an organization like the Detroit Wayne Mental Health Authority or to some mental health agency so that they can get some assistance. Question, persuade, refer, QPR. And that is an approach that works. It's an evidence-based approach, and you can learn more about that if you contact the Center for Urban Youth and Family Development at 313-340-3101, or you can reach out to us online at cuyfddetroit.org. Just go to our website and you will see a button that you can click on to contact us. Once again, that's cuyfddetroit.org. And this evening, we will be conducting our monthly Coalition for Urban Youth and Family Development meeting. It is a Zoom meeting, so you can feel free to call in and be a part of the meeting. The Zoom ID number is 790 495 5710. Once again, that's 790 495 5710. That is the Zoom ID call. Just go on your computer or your phone, your mobile device, go to the Zoom app, open it up. The meeting ID once again is 790 495 5710, and the password is CUYFD. Once again, that's C as in cat, U as in Ulysses, Y as in youth, F as in family, and D as in develop. C as in center, U as in urban, Y as in youth, F as in family, D as in development. So that's the password, CUYFD. And the meeting ID once again is 790 495 5710. And that is the Coalition for Urban Youth and Family Development. Our strategy and our mission is to create a drug-free community on Detroit's west side. And as we close out today, remember that this week, May 15th through the 22nd, is Suicide Prevention Training Week. And you can get some training if you contact the Detroit Wayne Integrated Health Network, or you reach out to the Center for Urban Youth and Family Development at 313-340-3101 or CUYFDDetroit.org. And as we close, we want you to keep your head up straight, keep focused, and to remember the words that Nelson Mandela utilized for his 27 years of captivity. Out of the night that comforts me, black as a pit from pole to pole, I thank whatever gods there be for my unconquerable soul. In the fell clutch of circumstance, I have not winced nor cried aloud. And under the bludgeoning of chance, my head is bloody but unbowed. Beyond this place of wrath and tears looms but the horror of the shading. Yet the menace of the years finds and shall find me unafraid, for it matters not how straight the gate, how charged with punishment the scroll, for I am the captain of my fate and the master of my soul. And remember, when you're up against some trouble, meet it squarely face to face. Plant your feet, set your shoulders, lift your chin, and take a brace. And when the worst is bound to happen, in spite of all that you can do, remember, you may fail, but you may conquer. So see it through. Black may be the clouds about you, and your future may seem grim, but don't let your nerve desert you. Keep yourself in fighting trim. And if it's vain to try and dodge it in spite of all that you can do, remember, running from it will not save you. So see it through. Even hope may seem but futile when with troubles you're beset. But remember, you're simply facing what other men have met. So if you fail, fall still fighting. Don't give up whatever you do. Keep your eyes to the front, your head high to the finish, and see it through. Thank you for watching Urban Review.